Hello, Gold viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here at Gold. And today I'm chatting with Dr. Petrea Cober about her upcoming presentation titled The Classics versus New and Upcoming Therapies, which is better for neonatal seizures, which is part of a lecture pack titled Advancement in Neonatal Pharmacology. Welcome, Petrea.
Nice to meet you, Kristen.
It's lovely to have you here today. Thank you so much for taking time out of your busy schedule, meeting with us here today. So first of all, before we get into the topics and all the good stuff, where in the world are you coming to us from?
So I live outside of Cleveland, Ohio.
Wonderful. It's always good to know where our speakers are. You know, we're an international conference, and it's always lovely to know where everybody is in the world, because I feel like there is so much to learn from each other. And it's just lovely to have passionate professionals in the field from all around the world.
I completely agree.
So, Petrea, tell us a little bit about your background in pharmacology.
So yes, so I'm a clinical pharmacist at Akron Children's Hospital. I attended the University of Tennessee for pharmacy school, and then I did 2 years of residency afterwards. The first year was at Penn State in Hershey, Pennsylvania, and the second year was at the University of Michigan in Ann Arbor. After that, I was actually a surgical pharmacist, both in the NICU and the PICU, for about 5 years. And then 13 years ago, we moved to Ohio, and my family did. And I teach both at the College of Pharmacy as well as at the practice site.
Wonderful. Thank you for sharing that, your wonderful work you're doing there in the field and also teaching. That's absolutely beautiful. How did you end up to become passionate about the field of pediatrics and neonatal and NICU?
So pediatrics has always been really a love of mine. I've been drawn to children my entire life. I think that part of it is just the educator in me. I've always liked being around children. I think that, you know, they're the future and they are so exciting, and they're not as depressing, you know, as people when you actually take care of them. You know, they're always optimistic and looking towards the future. When I was in my actually, when I was a student first, and then throughout my residency, I had the opportunity to be in neonatal units. And I really just found a true passion for it. And that's really from my nutrition background. So I am a nutrition support pharmacist. And so I do provide a lot of information in the neonatal intensive care unit around nutrition. But with that comes many medications. And there's not a lot of information about those medications. So as a pharmacist, I get to be a real part of an interdisciplinary team and providing the information that I understand about neonates and their pharmacokinetics and their pharmacodynamics and how medications work for them.
Beautiful. Also talk a little bit. This is very exciting for me to hear that you're also part of the, you know, you have a background in nutrition there as well. Please talk about that.
So yes, so I think it's my love of math, but pharmacists typically make intravenous nutrition, and I was given the opportunity to have a rotation as a student in a nutrition support service at the Children's Hospital at Le Bonheur at the University of Tennessee in Memphis. And it really started me on a path in which I really loved nutrition support. And I was able to do rotations throughout both my years of residency, definitely got very much involved in that throughout my time with the surgeons at the University of Michigan, and really got involved with the American Society for Parenteral and Enteral Nutrition. And so it really has enhanced what I do, the education I provide to learners, to trainees, to other disciplines, very commonly giving lectures to nurses and dietitians and physicians about parenteral nutrition, and just the importance of, you know, I can give you everything you need to an extent in parenteral nutrition, but what you really need is what your mom can give you, and that's human milk. So always reminding people of the importance of enteral nutrition, even if their patient can't currently take it.
Right. Absolutely beautiful. Yes, absolutely. Human milk, there is no substitute for it.
It's the one thing your mom can give you that I cannot.
Right, absolutely. Thank you so much for talking about that background. Very fascinating to me. It's interesting, and also, that background together with. Now, let's talk about your topic as well here: the classics versus new upcoming therapies. Which one is better for neonatal seizures? So, first of all, neonatal seizures. It's quite complex, right? Because there are many different reason for these seizures. Can you talk a little bit about it? Because I can think of, I'm not a pharmacist, but I can only imagine how complex that topic can get, especially with such a young and vulnerable population.
So the neonatal brain, even if its term, is very immature, and it has a dysregulation of the things that excites it and the things that depress it. And so with that in mind, they're a little bit more prone to seizures. Additionally, the birth period, as I like to tell my students, is not an easy process for anyone involved. And so there are definite risks for hypoxic ischemic events that occur. And so that's actually the biggest reason that most patients have seizures in the neonatal period is hypoxic ischemic encephalopathy. But in addition to that, our preterm infants also are at risk of bleeding in the head, so interventricular hemorrhages, which then the blood that's present in there also dysregulates the brain, and it makes it more prone to have seizures. So what are we supposed to treat these patients with? Because we're very scared to give medications to a developing brain. So what this talk is really about is what is out there for medications in these patients.
Absolutely. And we want everybody to come and join this presentation. So we don't want to get into too many details here, but I do have a question, because you mentioned classics versus new. I can only imagine how much has changed there over the years, right? In therapies that are coming. And where do you see this going for the future as well?
I think in the future, as we have more information about some of these newer therapies, not only for what dose works the best to get the benefits for seizure control, but also has the least adverse effects to the patient, I think that as we have more of these studies, we will explore newer agents. Some of these agents are commonly used in the pediatric population and have really overtaken some of the classic medications that have been used for pediatric seizures. And so moving that down into the neonatal population and maybe considering newer agents that we can use for these patients and have those benefits as well.
Fantastic. Well, thank you so much. It's very exciting what's coming up here in the future there. Petrea, before I let you go, any final words for our viewers, anything that you would like them to know about the presentation and the topic?
So just to look at all the information that's given, it's still, the jury's still out on what is the best, but I think that as we build more and more information and have presentations where we talk about what potentially could be used in these patients, then we will be able to have more research and more opportunities to see what is going to happen long-term for these patients.
Yeah, well said. More research and more opportunities for these patients. Well, Dr. Petrea Cober, thank you so much for spending time here with me. It was a pleasure meeting you and talking about your background and the presentation you have here with us at Gold.
It was great talking to you as well, Kristen.
And now for our viewers, if you'd like to find out more about this presentation and other presentations in the lecture pack of Advancements in Neonatal Pharmacology, we would like to invite you to go to goldneonatal.com. You'll find information about that there. Currently, this package is an add-on package to our Gold Neonatal Online Conference of 2023, and we get started with that on May 30th. It's very exciting. We have 2 open access keynote presentations that are available to everyone without a cost. So make sure you sign up for your free seat there. And for all the recordings in the conference, they are always recorded as well, so you can watch them at a time that's convenient for you. Thank you, everyone, for watching, and I hope to see you at the conference, and I hope you check out this wonderful lecture pack. Bye-bye, everyone.